Don't tell them that I'm going to tell the other nurse to bring the blanket for you. Just go and get the blanket. They're not difficult patients. They're just patients. They have no idea what's going on. They're in a lot of pain. They suffered. And they just need your help. And we have to educate the patients. It's all about education. And education doesn't mean that you have to talk to them in detail about, those are for lawyers. You give them hope. You give them hope. You talk to them about their problems and tell them that they're going to be okay. And that's what the education means. Education doesn't mean that you're going to scare them to death. And you have to empower them. Empowerment is very important. We lost this art of giving patients responsibility, because they are responsible. They're part of the team. And we have to do all these with dignity and respect. Hospital is the environment that people lose their dignity. When my son was in the operating room and I was moving his body under anesthesia, it was hard. You have to respect people, even if they're unconscious, even if they don't remember. Dignity is everything for human. And we have to treat their pain, appropriately. Don't try to shut them down because they talk too much, and let's give them so much pain medication and not let them talk. And forget about blaming others. We are all team members. We have to take care of it. So many times you've seen me, pushing the gurney from the emergency room to the operating room. It doesn't decrease my reputation or my ego, or doesn't mean I'm a good surgeon or bad. I'm part of the team. So being accountable means you pick up the ball, you do it, it's okay. When you do it, you teach the other nurses to do it the right way. And teamwork is everything, you know that. And be positive, right? Be positive. I'm not one of those people say, be positive, your life is gonna be okay. Be positive doesn't mean that you ignore the negativity that happens around us every moment. Life is pain. Everyone knows life is pain. But remember, suffering is a choice. We don't need to suffer. We look at the painful situations and events and understand them and try to relieve those problems and see the positivity within them. There's a lot of positivity with every bad events. Like this epic thing right here, right? It's so much stress. There's a lot of positivity in it too. I promise you. And be patient, right? I said that many times, and the nurses, you know what they said? They said, Dr. Iraniha, you don't understand it. You don't understand what happens if number of my patients goes from 5 to 6. It's so hard, Dr. Iraniha. You don't understand it. You don't get it. I get it. I get it. I was 13 years old when revolution happened in Iran. Lives changed. Right now, in this moment, there's so many people don't have even water to drink. So many people don't have food to eat. Epic is nothing. Trust me. Having 6 patients instead of 5 patients is nothing for us. We are so powerful. Our mind is so powerful. 5 or 6 patients doesn't mean anything. When you do it right, when you do it from your heart, that's a gift that is being given to you. So you have to be patient, and you have to be tolerant with difficulties in the emergency room and difficult patients. Of course, people come in and hit you and stuff like that. It's okay. It's okay. We have share of those. And be generous. Generosity means everything. For contentment, you have to be generous. Generous doesn't mean that you pay $100 to your church. That doesn't mean anything. Generosity is when you spend your time, your effort, your energy, and that's what generosity means. Generosity means you do things and know and don't expect anything else from it. And be grateful. And be grateful has nothing to do with religion. Right? Be grateful means we are like a little tiny sand in the sea of the world. Just imagine, look outside, look at the sky. Just see how tiny we are. And the fact that we are here, we have the ability to talk and communicate and share feelings, it's magical. Whatever happened, it was evolution, it was God, it doesn't matter. We have to be grateful. Right? So, Patient Health Professional Experience Project, or PHPEP, is an idea about well-being of nurses and health professionals, and also creating and improving patients' experience. Okay? It's an invitation for you to, number one, recognize the meaning of what you do every day, the value, the purpose, and then the practice, virtue of humanity, the compassion, kindness, and care, and then to create that experience with the patient, and then to create that magical moment, those magical positive emotions, to create a new culture. That's the idea. And then, as Gandhi said, be the change you wish to see in the world, right? If we don't do it, most of you go out and then we're gonna check out again. I hope not. But that's happened. I'm very smart. I know it happens. And it's okay. Because if I inspire one person, I did my job. And you have to do the same thing. You might come to work every day and practice the same way and try to inspire your friends and colleagues. And a lot of people laugh at you. And a lot of people laugh at me right now, what I do. Because I don't get money right now for this, it's my time. But I do it for myself, my family, and you. To create the culture, we have to ask that question, how do we want it to be presented? How do we want to live? We want to live a mediocre life, or we want to live a full life. We want to be unique, and you're not going to be unique by having a best cardiothoracic surgeon or best cardiac care here in the hospital. There's a lot of people better than you. I'm not going to be good as a good surgeon. Nobody cares about me. There's a lot of other great surgeons. But you can be unique if you practice humanity, because that is scarcity, right? It's rare right now. So the idea is to create the Oasis for humanity. And that's the name of my website, by the way, that I created. It's going to be the website that is going to be online at the end of this month. And it's going to be interactive, and it's the idea to share our experiences. the ritual we talked about is not to put it on the wall and every day, again, light a candle and look at it and follow it. Most of those things are common sense that we have to do every day. But the ritual means reminding yourselves every day of what you do, the meaning of this. And also try to create those connections and experiences. And I promise you, if you do that, it will change your life. It will change your character. You feel different. You feel different. So please, go out and create experiences. Thank you.
Thank you.